My name is Gabrielle Hynd and I will be presenting on interprofessional communication with a particular focus on clinical handover and documentation and its relevance to my future as a qualified paramedic. I've chosen to expand on this topic as interprofessional communication is an important skill within the paramedic profession to ensure quality and safety of patient care. Hagemeyer, Hess, Hagen and Sora 2014 define interprofessional communication as communication occurring between healthcare professionals, patients and family members in a transparent, collaborative and responsible manner. In providing adequate pre-hospital care, paramedics must utilise best interprofessional communication practices with multiple healthcare professionals, including doctors, registered nurses and other allied health personnel. This enhances multidisciplinary collaboration, decision-making processes, and quality of patient care. Ferronda et al. 2016 discussed asynchronous and synchronous means of interprofessional communication. Synchronous communication, comprising of clinical handovers, is arguably the most frequently observed communication process between paramedics and other healthcare professionals. The primary objective of clinical handovers at the emergency department, ED, involves conveying pertinent case details and transferring the responsibility and accountability for ongoing patient care from paramedics to the receiving healthcare organisation. Paramedics are typically the first healthcare professionals that interact with patients within the pre-hospital environment, making the information they convey to the ED personnel paramount to patient safety and trajectory of care. The ED is a time-pressured, crowded and busy environment which makes this interaction susceptible to data loss and misinformation. During this time-pressured period, critical patient care decisions are discussed based on the information delivered by paramedics to ED personnel. As a future healthcare professional, it is imperative that I perform interprofessional communication skills to an excellent standard to ensure that I deliver high-quality clinical handovers for all of my patients. An effective clinical handover not only ensures continuity of care, but also promotes team functionality and performance, maintains patient safety, avoids adverse events, and reduces miscommunication or misinterpretation of data. Although a study conducted by Najifi Callahan et al. 2017 revealed that 34% of information communicated during clinical handover was misinterpreted by ED nurses, and 18% of information was inaccurate. Ferronda et al. 2016 reported that lack of confidence, cultural and linguistic barriers, differences in clinicians' expectations, patient complexity, lack of structure, and distracting factors within healthcare environments can adversely influence the quality of interprofessional communication. Such factors can contribute to a breakdown in communication, resulting in inaccurate or inappropriate omission of essential information, which in turn may have detrimental effects on patient care and safety, including delayed treatment, misdiagnosis, medication errors, and increased mortality and morbidity. As a student paramedic, such communication barriers have affected my ability to deliver effective handovers to ED personnel. In particular, my lack of confidence, patient complexity, and distracting factors led to misinterpretation, repetition, and clarification requested by the receiving personnel. In order to improve my ability to deliver a comprehensive patient handover in the future, it is important to remain aware of these information transfer barriers and to implement interprofessional communication skills to overcome the challenges. Interprofessional relationships, communication, context, and structured handovers were common themes revealed when exploring this topic. Successful interprofessional communication encourages positive professional relationships. This is achieved by demonstrating respect, shared understanding, and having an awareness of each professional's knowledge and skill set. A qualitative study investigating the incidence of adverse events resulting from clinical handovers noted that handovers should be succinct to ensure that only vital information is conveyed and presented with confidence and assertiveness. Context was another recurring theme identified. Given the demanding nature of the ED, it is unlikely that distracting factors, including interruptions and the crowded and noisy environment, can be avoided. However, Najafi Callahan et al. 2017 noted that following an appropriate handover tool will ensure that all pertinent information is delivered and inaccurate transfer or loss of information is avoided. A study conducted by Lederman et al. 2012 investigated multiple handover acronyms, including the SBAR and IMIS-AMBO. The results of the study demonstrated an improvement in interprofessional communication between paramedics and ED personnel following the implementation of IMIS-AMBO. IMIS-AMBO, a mnemonic for identification, mechanism of injury, injuries, signs and symptoms, treatment, allergies, medications, background, and other, promotes a concise and organised flow of pertinent information. This standardised tool reduced communication-related delays, inaccuracies, and omissions in patient care. Implementing such communication strategies in my future will ensure that I am delivering a comprehensive clinical handover, decreasing the risk of miscommunication or misinterpretation of information to ensure the safety and continuity of patient care. Asynchronous is another mean of interprofessional communication, which refers to written documentation. The primary purpose of written documentation is to provide a record of pre-hospital care, including pertinent findings, which is congruent with the clinical handover. Maintaining accurate, comprehensive, legible, and concise documentation is a core professional capability for registered paramedics. This promotes patient safety by managing the risk inherent in paramedic practice and ensures quality assurance. During my university studies, the importance of documenting all pertinent information was constantly reiterated, emphasising the notion that if you did not write it down, it did not happen. This is relevant if medical decisions are contested for a case and to ensure continuity. Continuity of documentation is of vital importance to patient care as multidisciplinary teams are involved in the management of an individual patient. Completed and accurate documentation will ensure that appropriate information is provided to all relevant healthcare professionals to promote decision-making and multidisciplinary collaboration, thus benefiting the patient by assisting with their diagnosis and trajectory of care. Additionally, Ho, Gadd, Korist and Rosenblum 2014 stated that appropriate documentation assists with research, education and legal purposes. My ability to deliver comprehensive clinical reports improved throughout my clinical placements. At the beginning of my studies, although I understood the importance of documentation, I found it challenging and lacked the ability to incorporate all pertinent information. Poor or incomplete clinical documentation can result in misinformed healthcare professionals and patients, lack of continuity of patient care, unnecessary test repetition or investigations, prolonged hospital admission, and increased medical legal risks. Such outcomes highlight the vital importance of clinical documentation in a healthcare setting. To avoid delivering poor documentation, it is important to investigate what must be incorporated into my documentation as a future healthcare professional. Guidelines issued by Queensland Health in 2012 state that clinical records should be objective, accurate, complete, and contemporaneous. Clinical records are legal documents which must be accurate and pertaining to information and assessments that led to the treatment decision for that patient. It is important to avoid subjective notes, only including objective documentation which is quantifiable, analytical, and measurable. Clinical documentation must reflect a complete account of the patient's history, chief complaint, assessments conducted, and treatment provided. Literature notes that contemporaneous documentation reduces the risk of inaccuracies and potential omissions. Such principles must be implemented into my future practice to ensure that I deliver appropriate documentation to safeguard patient safety and continuity of care. This presentation explored the importance of applying effective interprofessional communication skills in my future practice, with an emphasis on clinical handover and documentation. With the safety and continuity of patient care at stake, learning to communicate effectively and efficiently during clinical handovers and via documentation is imperative and an integral component to my future as a paramedic professional. This topic has provided me with an understanding of the barriers to effective interprofessional communication, including cultural, social, and environmental factors that may hinder and disrupt the quality of my handovers. In forming my action plan for the future, I have learned that utilising a structured handover such as IMS AMBO can assist when delivering complex information in a chaotic environment. 2, I must conduct my clinical handovers clearly with confidence and assertiveness to minimise the risk of misinterpreting or miscommunicating vital information. Clinical documentation was also explored, which highlighted the association between poor clinical records leading to medico-legal risks and lack of continuity of care. In order to mitigate adverse outcomes, my clinical documentation must be accurate, objective, and completed contemporaneously. As a novice paramedic, I must continually aim to improve my interprofessional communication skills in order to deliver comprehensive clinical handovers and appropriate documentation to promote patient safety and improve patient outcomes. Thank you for listening.